So you or one of your loved one has been diagnosed to have colorectal cancer. What are the next steps? What further needs to be done? Hi, this is Dr. Chintamani Godbole. I'm a surgeon specializing in the treatment of colorectal cancer. And in this video, I would take you through the 4 steps that are necessary once a diagnosis of colorectal cancer is done. Step 1 is correct diagnosis and staging. Now, a diagnosis of a colorectal cancer can only be confirmed on a biopsy. The biopsy is in most cases done through a colonoscopy, in which a endoscope or a telescope is passed through the anal area and the entire colon is screened. Whichever part the tumor or the mass is found, a biopsy is taken, and the biopsy has to show something called adenocarcinoma to make a diagnosis of colorectal cancer. Once a diagnosis is confirmed, next step is staging. Now for staging, you need a CT scan or a PET CT scan which covers the entire chest, abdomen and pelvis. Although a PET CT is not considered to be necessary for diagnosis of colorectal cancer, in most centers it is the preferred investigation. So a colonoscopy with a biopsy and a CT or a PET CT is a bare minimum that is necessary for staging of colorectal cancer. If the cancer is involving the rectum, which is the last 10 to 15 centimeters of the intestine, then you often additionally need a MRI of the pelvis to look at the stage. Once the diagnosis is confirmed and the stage is known, the next step is treatment planning. Most cancers nowadays are treated with multimodality treatment, which includes a combination of surgery, chemotherapy, or radiotherapy. Therefore, it is important for the patient to see a specialist surgeon and a medical oncologist at least for this treatment plan. Now, in my earlier videos, I have discussed about MDT meetings or multidisciplinary meetings in which the specialists looking after a particular diagnosis come together and do treatment planning. Unfortunately, in India, this may not be possible in all the hospitals. Instead of that, at least if you meet a specialist surgeon and a medical oncologist, and both these specialists, if they discuss amongst each other and come up with a treatment plan which is specific for the patient's stage and the patient's overall condition, then it is extremely helpful. So to summarize, treatment planning often involves inputs from multiple specialists, the bare minimum being a surgeon who specializes in treatment of colorectal cancer and a medical oncologist. A radiation oncologist or a gastroenterologist may be necessary, especially if you are dealing with rectal cancer. Once treatment planning is done, then comes the step of treatment execution. Usually for stage 1 to 2 colorectal cancer, the only treatment that may be necessary is only surgery, and patients usually do not need any further treatment like chemotherapy or radiation therapy. However, in some cases of stage 2 and all cases of stage 3 colorectal cancer, the patient needs a combination of surgery followed by chemotherapy. In cases of rectal cancer, the patient is very likely to need some treatment before surgery, which might include radiation therapy alone or a combination of radiation and chemotherapy. Whatever the treatment be given, once the treatment duration is done, then comes the next step, which is the step 4, which is surveillance. Now, like any cancers, colorectal cancer also can come back, and the highest risk of recurrence is within the first 3 years. The cancer might either come back within the colon or it can come back around the colon in the abdomen, such as in the lymph nodes or at the previous site of the tumor, or it can come back in distant organs like liver, lung or bones. Therefore, the surveillance plan is catered accordingly to pick up these recurrences. The aim of surveillance is to detect a recurrence early, if at all it happens, so that it can be picked up and treated accordingly. Surveillance involves regular blood tests, which includes tumor markers like CEA. It involves a CT or a PET CT, again of the chest, abdomen and the pelvis. And it involves colonoscopy to look at the colon and identify any recurrences within the colon, if at all they may happen. Once the treatment of the patient is completed, the patient is usually given a follow-up protocol or a surveillance protocol where precise instructions are given at what point the patient should come to the physician or the surgeon to do these sets of blood tests, colonoscopy, and CT scan, and they usually go on for the first 3 to 5 years. So to summarize, if a diagnosis of colorectal cancer has been done, the further plan involves 4 steps. Step 1 being correct diagnosis and staging. Step 2 is treatment planning. Step 3 is treatment execution. And step 4 is surveillance.